Good evening, viewers, and welcome to tonight's regional news. We begin with news from Trinidad and Tobago. Trinidad and Tobago has recorded the deadliest day for the COVID-19 pandemic to date. In the last 24 hours, 9 people have succumbed to the disease. The country has recorded 55 deaths for the month, making May 2021 the deadliest month for the pandemic, averaging 5 deaths a day for the last 11 days. The previous record high monthly death toll occurred in September 2020 with 54 deaths reported. According to the Ministry of Health, Terence Dilal Singh, the 9 deceased included 7 people with comorbidities. In the last 24 hours, 348 people have tested positive for the disease, marking the third highest jump in daily reported COVID-19 cases to date. Trinidad and Tobago's COVID-19 hospitals continue to be under strain due to rising cases. With a total of 335 in hospital, this marks the second highest number of patients since the pandemic began. We tell you now that 9 people, including 7 children, were killed on Tuesday and many more badly wounded after a lone teenage gunman opened fire in a school in the Russian city of Kazan, local authorities said, prompting a Kremlin call for tighter gun controls. Calling the attack a tragedy for the country, Rustam Maikinov, the head of the wider Taristan region, said there was no evidence that anyone else had been involved. Maikinov explained that the terrorist has been identified as a 19-year-old who was officially registered as a gun owner. He has since been arrested. He said the victims were in the 8th year of school, which in Russia would make them around 14 or 15 years old. Maikinov, the regional leader, said 18 children were in hospital with a range of injuries, including gunshot wounds and broken and fractured bones. 3 adults with gunshot wounds were also in hospital, he said, saying doctors were doing all they could to save the lives of those wounded. And now for an update on the Colombian protest. Dozens of people have died since a wave of protests started to sweep across Colombia on April 28. Protesters have blocked key roads, leading to shortages of fuel and food in some areas, and there have been violent clashes between the security forces and demonstrators. The government has agreed to meet protest leaders, but with more and more groups joining in the protests, the demands of those who have taken to the streets have widened and a quick resolution seems unlikely. The demonstrations started on April 28 and were initially in opposition to a proposed tax reform. The government argued that the reform was key to mitigating Colombia's economic crisis. Colombia's gross domestic product dropped by 6.8% last year, the deepest crash in half a century. The proposed reform would have lowered the threshold at which salaries are taxed, affecting anyone with a monthly income of 2.6 million pesos or more. It would have eliminated many of the current exemptions enjoyed by individuals, as well as increasing taxes imposed on businesses. The rallies on April 28 were organized by Colombia's biggest trade unions, but were also joined by many middle-class people who feared that the changes could see them slip into poverty. And finally, member of the World Health Organization WHO Strategic Advisory Group of Experts, SAGE, Working Group on COVID-19 Vaccines, Professor Peter Figueroa, says the AstraZeneca vaccine is very effective and safe for almost everyone to receive, including pregnant and breastfeeding women. Professor Figueroa also emphasized that there is no other substance that enhances the body's immune response to an antigen inside the AstraZeneca vaccine. He said that the only persons he encourages to hesitate in taking the vaccines are those undergoing cancer treatment or persons who have a very low immunity and are acutely ill. In addition, he said individuals recovering from COVID-19 should wait between 4 to 6 months before taking the vaccine. This delay, he said, not only facilitates the recovery process, but also allows the body to build natural immunity from the virus. And that is all for your regional news. Thank you for joining.